Hello, my name is Parinaud, and I will talk about Parinaude's ocular gland syndrome in cat scratch disease. Definition: it's an infectious disease consisting of gradually progressed regional lymphadenopathy as febrile malaise, often occurring after contact with a fleeing animal. A typical presentation is characterized by a variety of neurologic manifestations as well as a granulocytes in both of the eyes, liver, spleen, and bone. The disease is usually cell limitation, and recovery is typical complex. Wolver patients with a typical presentation, especially if immunocompromised, may observe significant mortality and even mortality.
Symptoms of cat scratch disease may. I'm Gabe Garza with today's health news. House pets can harbor many common bacteria, but while most are harmless, a few can cause serious illness or even blindness. That appears to be what happened to Janice Walters, who awoke blinded in one eye. Walters thought she had pink eye, but doctors concluded what she actually had, cat scratch disease, which came from her feline friend. As the name suggests, cat scratch disease is a bacterial infection transferred from cats to humans through their saliva or fur. It can be transmitted when a cat bites, scratches, or licks a person's open wound, reports the CDC. Symptoms of cat scratch disease may include fever, muscle pain, and a fluid-filled sore at the site of the scratch or bite, reports CBS News. The CDC recommends avoiding stray cats, washing cat bites and scratches with soap and water, and washing hands after playing with a cat or kitten.
Hi, I'm Dr. Lloyd Lillywhite here, talking about Bartonellosis. It's one of those zoonotic diseases that's transmitted between people and animals. You probably say, well, I've never had Bartonellosis. Nobody ever told me I had it, and I don't know anyone that's ever had Bartonellosis. However, you may have known someone that had cat scratch fever. Cat scratch fever is caused by this organism, Bartonella henselae. It's transmitted from one cat to people by means of cat scratches or bites if that cat has been in contact with fleas or a flea-infested area, or the people may get the disease by direct contact with those fleas. A lot of people have had it. Serologic surveys show that about 23% of the people have had this disease. Most of the time we don't know it because it's a very mild infection. However, sometimes more serious complications develop. With cat scratch fever, it is a very painful skin infection, and it can involve the lymph nodes. Immunocompromised people and children are at greater risk of serious complications with this disease and may have systemic or fatal disease of very great importance. We need to prevent Bartonellosis or cat scratch fever, and there are ways that we can accomplish that. The primary thing is that we need to provide adequate flea control in cats. This is the most important measure we can take. Immunocompromised people should adopt only cats over 2 years of age who have been in flea-free environments and in good health. These cats should be kept indoors. The reason why they should adopt only cats over 2 years of age is because by 2 years of age, cats develop immunity to this disease. So the older cats are not presenting a risk to us. But again, the most important thing we can do is to keep our pets free of fleas. That will help them be healthy. It'll help us enjoy their company, and life for all of us will be better.
Application in medicine. Bartonella organisms are type involve and colonize natural erythrocytes or endothelial cells. Endothelial invasion led to a pro-inflammatory response and vasodilation. Systemic and ocular infection are dependent of autoimmune state of the infection individual. CSD, acute manifestation with systemic infection include fever, malaise, anorexia, and lymphadenopathies. These symptoms occur with 1 and 2 weeks with the contact with the infection organism. Pros and cons. Pros. Typical history of protonal symptoms, lymphadenopathies, and CAPS both help stringent diagnostics, especially when present in the young adults or children. It's more commonly present in the young age in the late summer and fall months. Cons. CSD tends to be a still limited disease treatment depending of age, immune status, systemic manifestation, and ocular complication.
A new CDC report says that more and more people are being hospitalized for cat scratch disease. The illness has been around for decades, but in recent years, a higher percentage of patients have developed serious, potentially fatal complications. If you have young kids or loved ones with weakened immunity, you need to know that cat scratch disease is a bacterial infection that is transmitted to humans when an infected cat bites or scratches a person badly enough to break the skin or licks a person's open wound. The infection is usually mild. The wound can become inflamed and painful, and the person may also develop a fever, headache, loss of appetite, and swollen lymph nodes. But occasionally, an infection from cat scratch disease spreads to the brain, eyes, bones, muscles, or heart. This can cause swelling and damage to these organs and can be fatal if prompt medical attention isn't received.
Stated inequality. Patients typically present with a unilateral decline in vision, with symptoms, the systemic symptom present in 67%. Unilateral competitive injections, foreign body sanctions, and epiformulations and head hatch in favor that one range of versions. Other may present with a chocolate if the optic nerve is involved. And conclusion, etiologies that must be differently include other causes of the nerve head, such as optic neuritis and sarcoid papillitis. Also, infection etiologies such as sensorytic perineuritis and rare toxoplasmosis can produce a similar clinical appearance. So tumoral nerit can mimic the less frequent appearance of the bilateral. Line dishes, rock mountain, spoke fever, toxoplasmosis, toxocariosis, histoplasmosis, and leptospirosis may also cause neuroretinitis.
How to prevent cat scratch disease. Cat scratch disease (CSD), also known as cat scratch fever, is a bacterial disease caused by Bartonella henselae. Most sufferers of CSD have been scratched or bitten by a cat. The disease is not usually serious, but can be if you have a weak immune system. Staying healthy. Know if you are at risk. Some people are more likely to get CSD than others. Organ transplant patients, infants and young children, and pregnant women are more likely to get diseases from animals. Wash your hands after handling your cat. Always wash your hands with soap and water after playing with your cat. Don't play with your cats too rough or they might hurt you. If your cat bites or scratches you, wash the wound with soap and water immediately. If you start to feel ill after getting a scratch or bite, go to the doctor. Go to the doctor if you suspect you might have CSD. Cat scratch disease is hard to diagnose, but if your doctor suspects you have it, they might run tests. If you have an infection at the site of a scratch or bite and/or feel ill and fatigued, you might have CSD. Typically, CSD is not serious and does not require any treatment. Sometimes you might be given an antibiotic, especially if you have a weak immune system. If you are immunocompromised, CSD becomes more serious. Physical symptoms include swelling around the cat bite or scratch, and swollen lymph nodes, especially around the head, neck, and arms. Other symptoms include fever, fatigue, and headache. Rarely, it causes vision problems, liver disease, and confusion. Adopt older cats instead of kittens. Instead of adopting kittens, adopt cats that are over 1 year old. Kittens and young cats are more likely to carry CSD and are more likely to give you CSD because they are more likely to scratch. Don't let your cats lick your wounds. This is another way that your cat can spread the bacteria that causes CSD to you. If you see your cat licking a cut or an open wound of any kind, stop them. Cover your wounds with bandages to avoid your cat being able to lick them. If your cat does lick your wound, make sure to wash it thoroughly with soap and water. Feral cats. The cat might not have an owner who is taking care of them, which means they are more likely to have CSD. You don't know how it can give you CSD. Keep your environment clean. It is important to keep your house extra clean. Before you vacuum, shake and punch out your cushions and pillows on the floor. Wash all your bedding in the hottest water possible to kill fleas. 10.
Thank you.